Dr. Samuel Kaba Korea is the Director Institutional Care at the Ghana Health Service and coordinator of the laboratories for testing. He essentially leads Ghana's coronavirus test team. He joins us in the studio now for some discussions on the issue of stigma and how this is hampering efforts to fight the pandemic. Thank you very much, Dr. Kaba. Now, we've heard a number of these stigma stories. How bad is the situation?
Thank you so very much to you and to everyone listening to us right here in Ghana and beyond. First, let me say, express my deepest gratitude to all the health staff, the security agencies, and the media for the ongoing education and handling of this coronavirus issue. Now, straight to the point, we are really feeling it right now. It's extremely sad for us because, one, the patients that we diagnose and they are in the community, it's become very difficult for us to access those communities and get them out. Even in some instances, they don't even want to see the ambulances around the community. Two, because of the stigma, people don't want to go to the hospital when they know that they've been in contact with someone who had the disease. And it's so hard for us because once you delay going for medical attention, by the time we get it, it's too late for us to be able to deal with you appropriately and get a good recovery. So all these things make us really sad. Now, let me say this. We all have seen in abroad where Boris Johnson had it, Prince Charles had it, the Prime Minister of Canada's wife, they all came out. Idris Elba, they all came out and said, look, I have this. And that is what we want from our people too. That influential people, we need faces, we need champions, we need the religious bodies, we need community leaders, the chiefs, the queen mothers, we need everyone on board. This is about community ownership. This is about community empowerment. That is the only way we can fight COVID-19. Because each case that you keep in a community can affect the entire community. And now, let me say this.
Dr. Kaba, isn't it a case of, before you say that, isn't it a case of people just being cautious, considering the mode of infection or transmission? In other words, where do you draw the line between people being cautious and maintaining a social and physical distance and stigmatization?
You know, one thing is being cautious, where you maintain the social distance, where you keep up your hygienic issues, where you wash your hands and all that. And another thing is actually discriminating against someone because the person had COVID-19, was positive. So here's the point: you don't want the person to get closer to you. You don't want the person to talk to you. Like the gentleman just said, he has gotten 2 tests, negative. He's cured, right? And yet people don't want to get closer to him, and people don't want to get closer to his family, who are also negative. And those are the things we saw during HIV time. Those are the things we saw at the beginning of TB. And that actually prolonged the disease, because then people have it, they don't want to bring themselves forward. And we have, let me say this, if you have Boris Johnson come to Ghana, wouldn't we be the same people to go receive him at the airport? Wouldn't we be the same Ghanaians to want to get closer to Idris Elba? Wouldn't we be the same people to want to meet with the Canadian Prime Minister's wife? Then why don't you want to accept our own brothers and sisters? This is the time we have to show love. This is the time we have to understand that we need the entire country, we need the communities to embrace their people and get to know that together that's the only way we can fight it. If you try to avoid them, then the spread is even is more, and the control becomes difficult.
Dr. Kaba, the other issue which has been on many minds is Ghana's recovery rate as compared to other countries in the West Africa South region. Currently, we have 83 recoveries. We're looking at probably another 17 to take it to 100. But if you compare that to neighboring countries, Burkina Faso, Cote d'Ivoire, and the rest, they seem to have a rather much higher levels of recoveries. What is it that we're not doing right?
I think we are doing everything right.
Or what is it that they are doing right?
We are doing everything right. Fortunately enough, I belong to the West African Rapid Response Team. We do have our Zoom calls just like we have meetings, virtual meetings. And one of the issues we wanted to define this week had to do with the recovery rate. Now, we got to know that for every country has its own criteria in defining what they call recovery, based on 5 things. One has to do with transportation, availability of transportation. I'll come to that and explain why. 2, communication. 3, infrastructure, health facilities. 4, the human resource. So you got some of these our brother countries where they actually test you for the first time. When you are positive, they say you're positive. They keep you for 14 days. And then after that, they tell you that they call you, to place a call. Are you doing all right? Yeah, okay, I've survived. Okay, then you recovered. Without doing a laboratory test to say that you have actually recovered. We got other people who go for 21 days because they say, look, we don't have the test case. We can keep you for 21 days. Now, WHO recommends 2 things. One, that when you get someone positive, you keep the person for 14 days, right? And then after that, you do 1 test. If it comes out negative, you do a second test within 24 hours. If both tests are negative, you'd say the person has recovered. Now, if you don't have the testing capacity, what you do is that, look, you test the person for the first time is positive, you run the 14 days. When the symptoms are down, you give him 14 more days. And then you say, look, I'm sorry, I don't have the testing capacity. After 28 days, we think that you are recovered. What is Ghana doing? We say that, look, we will keep you for the 14 days. We'll do the first test. When it's negative, we do the second test. We get you negative before we say you are cured. So when we say you are cured, you've recovered. Now, if we do the second test and it's positive, we run you for 21 days. Then after that, we go through the same sequence. We do the first test, and then after 24 hours, we do the next test. So we need to always have our 2 tests completed before we do that. Now, I also spoke about infrastructure. This is what is happening. In the neighborhood, we are among a few people with hospitals actually designated for COVID-19. The rest, they have some hospitals, okay, but most of the cases are being home care. But we also do know that home care is not that good because a lot of people can just not do it. So what happens? When we test you positive, we take you to the treatment center. What we do is we evaluate you and we ask you, can you do home care? If you say yes, we say, all right, we will take your word. But we will go with you to your house with a checklist. We make sure that, yes, your house has all the conditions to do home care and you're not going to infect anyone else. Then we assign you to a doctor who will be talking to you twice a day, right? Then you take your temperature and all that, and then we get to know. After 14 days, we do the test. 1,
so essentially, we have a more rigorous approach to this.
When I finished talking to on the Zoom line on the meeting, and one of the guys said to me, oh, no, Takaba, then we all have to come to Ghana. I say, you know what? You come to Ghana after 52 days because we are locked down. After that, you come 52 days when you are all, we are all now assured that there is no more COVID-19 over there. We're actually doing the right thing because we actually have the capacity to test and make sure that we get things right. So I am personally not worried about the issue of the low numbers because we are actually following the time frame and we are actually doing what has been stipulated to be done. Yeah.
All right. Thank you very much, Dr. Samuel Kaba Akoria. He's the Director, Institutional Care at the Ghana Health Service and Coordinator of the laboratories for testing. He essentially leads Ghana's COVID-19 test teams. And you're watching Joy News Prime. We're taking...